I'm going to start off by saying that it's really great to be here this morning. Thank you all for joining, and for those of you listening in, I appreciate you all. I'm going to start off a little off script and just speak specifically to white people, if I may, specifically white individuals who are striving to be better allies or identify as allies with black and brown people against systematic racism. I want to say I appreciate you. As someone who is an ally for women, the trans community, and other communities, I know how difficult and hard it can be. It's daily work, but it's so important. And so again, I want to say that I appreciate you. Okay. Racism is often referred to as an affliction of the mind and heart, but I would extend that to say that racism, or should I say systemic racism, is also a public health crisis. Now, one area that receives a great deal of attention is death by policing. Michael Brown, Eric Gardner, Sandra Bland, Freddie Gray, Philando Castile, Breonna Taylor, and now George Floyd, not to mention the countless others who are killed by the police that are not covered by the media. Now, the names that I just listed off are the names of Black Americans who've had their lives cut short due to actions of the police, those who are here to protect and serve. But the truth is, for Blacks in America, policing in America is not a story of protection, but of harm. The state-sanctioned violence perpetuated by the police on Black bodies has been very costly. Indeed, a recent study published in the Journal of Epidemiology and Community Health shows that a disproportionate number of total years of life lost due to encounters with the police were experienced by Black and brown folk. Now, as a Black man, this is not surprising to me. This is not news, and I had imagined that for many of you listening in, this is not news as well. The reality is violence against Blacks is not the exception, it is the rule. Violence against Blacks in the United States is as American as apple pie and baseball. That's the only time you'll hear me make a sports reference, by the way. However, it's important to understand that there does not exist one institution in our society that does not perpetuate violence against Blacks. The focus on police brutality is justifiable, but ignoring the other sources of violence can have deadly consequences. You were likely able to identify the faces listed on the previous slide. They received quite a bit of media attention. And indeed, the protests that we are seeing today across this country are due in large part to the violence caused to the Black community by the police. But Kira Johnson, the woman pictured here with her husband and infant child, was not killed by the police. She died shortly after delivering her second child. She died in the hospital. She died after receiving inadequate care from those who swore to do no harm. Now, it was important to say that maternal death is not unique to Black women. In America, we have a higher rate of maternal mortality than in countries like Iran, Turkey, and Kazakhstan. However, as with many outcomes, we find that Blacks are hit hardest. The director of the Centers for Disease Control and Prevention's Division of Reproductive Health, Wander Barfield, stated, quote, "A well-educated African-American woman with more than a high school education has a 5-fold risk of death compared to a white woman with less than a high school education." This is not a matter of class, this is a matter of race. The Institute of Medicine published The Unequal Treatment in 2003, and that's focused on the racial disparities in health outcomes, of which maternal mortality is but one. Obesity, breast cancer, diabetes, cardiovascular disease, these chronic diseases disproportionately impact Blacks. They are more common and they are more deadly for people with Black skin. And we can currently see this with COVID-19. This chart shows the proportion of Blacks in several states and also shows the proportion of COVID-19 cases that are Black. Now, across each of these state contexts, we see that a disproportionate number of Blacks are afflicted by this disease. Now, I might add that they are also more likely to suffer from severe illness due to COVID-19. So, in general, blacks die quicker and live sicker than whites. So, why do we see this? Why is it the case that race has such a profound effect on one's health? Biological distinctions between blacks and whites have been debunked, though the idea is still alive and well in the American consciousness. Now, if we conclude, as social and medical scientists have, that race is indeed a social construction, then racial inequities in health are also socially constructed. That is to say that they are caused by social factors. Now, often you will hear that racial disparities in health come down to differences in health behavior across racial lines. So if we take type 2 diabetes, for example, eat well, exercise, visit the physician regularly, and you will be able to prevent this chronic disease. The idea here is that one's health outcomes are the products of their individual choices. So if one is sick, it is because they fail to take proper action to keep themselves healthy. In the context of racial disparities in type 2 diabetes, then, given that blacks are more likely to suffer from the disease, what would that mean? It means that blacks are predisposed to make unhealthy choices, thus leading to higher prevalence of type 2 diabetes. Now, educated folks tout this position all the time, including the Surgeon General of the United States, Dr. Jerome Adams. We will return briefly to COVID-19. That's the disease that Dr. Adams was referring to and talking about when he was speaking to reporters and addressing the fact that blacks are hit harder by the virus than their white counterparts. And his advice was that blacks should avoid alcohol, drugs, and tobacco. Now, this is excellent advice. However, this advice fails to acknowledge the fundamental cause of these health-related behaviors. And in so doing, it hides the role that systemic racism plays in shaping the health and well-being of African Americans. Now, it will be foolish to think that our individual actions have no connection to health. They do. However, any real analysis of health behaviors would be incomplete if we did not consider the social context in which people are embedded. Now, a classic idea in sociology is that we as individuals have agency or free will. However, our social structures both permit and constrain our agency. We can eat healthily, but how do we accomplish that if we have the misfortune of living in food deserts? Which, by the way, is the reality for a disproportionate share of blacks in America. We can visit the physician, but how can we, lost my notes. How can we do that without adequate health insurance? Medical sociologists turn to what is referred to as fundamental cause theory, which argues that our health behaviors, these so-called proximate determinants of disease, the conventional things like eating well and diet, are influenced by these more distal causes. And the reality is that in America, race, or more appropriate to say racism, is a fundamental cause of poor health in America. Redlining, residential segregation, housing discrimination, all of these policies meant to keep black folk out of well-resourced communities has contributed to an environment, a context, in which many blacks find themselves unable to engage in the very things that may save their lives. Racism is a fundamental cause of poor health. In order to address these inequities, racism must be abolished. I want to turn my attention now to medical care providers. Now, as a macro sociologist, I pay a lot of attention to social structures and tend to not really care about what's going on in people's heads. However, I have enough knowledge of social psychology to be able to discuss the process by which individual physicians and healthcare workers more broadly fail to uphold their oath to do no harm to their black patients. This medical racism has deep roots. J. Merriam Sims, who's pictured here, is regarded as the father of gynecology. And he regularly experimented on slave women in the mid-1800s, operating on them without their consent and without anesthesia. These experiments were justified because blacks were viewed as inhuman. More recently, the government's commissioned Tuskegee syphilis study, which began in 1932 and ended only in 1972, targeted blacks in the South, withholding effective treatment for syphilis among black patients to see how the disease progressed. Of course, it is difficult to see how this act could be carried out on fellow human beings. The solution? Blacks are inhuman. Flash forward to today. Black bodies are deemed biologically different than their white counterparts. A 2016 study conducted by Hoffman and colleagues found that a majority of white medical professionals held the belief that blacks have a higher threshold for pain, that they are biologically stronger, that they have thicker skin. The study went on to find that these false beliefs led to differences in pain treatment and management across racial lines. Specifically, physicians tend to underestimate the pain experienced by black persons, which leads to undertreatment and the subsequent suffering of blacks. This bias, combined with views of blacks as susceptible to addiction and media representations of blacks as drug addicts and drug dealers, is partly responsible for the reluctance of medical professionals to prescribe effective pain medications to their black patients. Now, pain is the way the body communicates to us that something is wrong. It helps us to avoid harmful situations. But if that pain is not recognized by those trained to heal us and make us well, pain is just uncomfortable and debilitating. If we return to Ms. Kira Johnson, she experienced excruciating pain while in the hospital, which was ignored over and over again by physicians and healthcare workers. By the time they finally addressed her issues and proceeded with an operation, they found her abdomen full of blood and were unable to save her life. Has she been listened to? Had her pain been taken seriously? Had she been seen as human? Perhaps she would still be here. Now, to be clear, I do not believe that all physicians are racist, excluding, of course, J. Miriam Sims and the founding fathers of modern medicine. Moreover, the implicit bias or unconscious bias that leads to this disparate treatment in healthcare is just that, it's unconscious. However, the long-standing view that blacks are less than human, the outright refusal of whites to recognize the humanity of black people, has put us in a situation where the medical institutions are failing to heal and care for black people. So what is the solution? Dana Matthews' book, Just Medicine, A Cure for Racial Inequality in American Healthcare, primarily focuses on legal solutions to the problem. For example, easing the burden of proof on plaintiffs attempting to prove implicit bias and negligence on the part of their physicians. However, this book also addresses structural solutions and changes in medical training. And we know what we have to do. If we were to eliminate residential segregation, for example, we would get rid of black-white differences in education and income, resources that are important for maintaining health. But remember, it's not just class, it's also race. Research indicates that first-year students hold less implicit racial bias than fourth-year medical students. But by the time those first-year students complete their medical training, this difference disappears. Now, what does this say? Well, it says that there is something about medical school and training that acculturates and socializes physicians into adopting harmful attitudes and biases toward their black patients. There's something wrong with the medical training that people are receiving that makes these biases more likely. So simply diversifying healthcare providers does not fix the problem. After all, it's important to note that these implicit biases are present even in black physicians. We must change the institution of medicine which perpetuates racial bias, specifically encourage physicians to acknowledge their implicit biases and actively work on being anti-racist. But this takes work. This takes advocacy. It takes protests, donations, and voting. It also takes outrage. Outrage at the status quo and the belief that things should be better. But change will not come from black outrage alone. It is crucial that white folk use their privilege to help change these institutions. It is not enough to merely know about these inequities. It is not enough to share a tweet or Facebook post. Changing this system requires active engagement. It requires a commitment to anti-racism, the active dismantling of systems of oppression. It starts with reparations, where the economic and living environments for blacks are made equal to their more privileged peers. It requires a revamping of medical training that focuses on reducing implicit racial bias, or at least preventing said bias from manifesting as differential treatment. Only then will we be able to live in a society where physicians can truly claim that they are upholding their Hippocratic oath. Only then will we be able to mitigate racism's role in the ongoing public health crisis.
Thank you for listening to our podcasts. We are entirely dependent on the donations of our listeners and members. We hope that you find this content to be important enough to help us keep offering these podcasts to the public at no charge by becoming a regular contributor. Please click on the donate button on our website, www.spfccc.org. Thank you for your support of progressive religious programming.